Welcome to the Auburn Medical Group YouTube live stream. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Welcome to the Auburn Medical Group live stream with Dr. Mark Vaughn and...
Hey, I'm Dr. Gawain Vaughn. Look at that.
Yeah.
That's me.
So we would like to talk to you about vitamins and supplements because
exciting.
It's like, I should have checked to see. I know it's $1 billion at its but I don't know.
Yeah, it's huge.
Beyond that, just crazy how much money people are making off of convincing people they need vitamins and supplements. And it's endless what they say the benefits are, even though they're printing right on it. These claims not cleared with the FDA. We're not making any claim that this
as long as you put that on there.
Yeah, then you have a clear conscience. Didn't you used to work in one of these places?
I did. Yeah, I did a summer internship at a vitamin factory. I did. True story.
Yeah, I think I ran by where it used to be today on my
you probably did.
My midday run.
Not there anymore.
So it is just everywhere, and we don't want our viewers to fall for this. And, you know, you have better things to spend your money on, like Super Chats. Thank you, Lindsay and Antoine. We're going to go through 5 points. The FDA is in charge of medications that they approve and testing and approving medicines. They have no authority over these things.
Prescription medications.
That have the little black box or even without a black box, hiding their disclaimer, these product not making any claims to diagnose or treat any condition.
Right. Yeah, as long as you have that, you're all right. The so any medication, I guess even over-the-counter medications, Tylenol, Advil, all of those, they have like standards that they need to meet according to the FDA. Any medication, prescription or over-the-counter needs to meet standards. However, supplements, there's no prior approval needed. We could set up a shop and throw stuff together and start selling
sell it, and nobody's looking at it. Except for...
Well, there's a little...
Consumer Lab looks at things.
Exactly,
ConsumerLab.com, I think it is. But their information is not available to the public because nobody's paying them to do it except for subscribers. So I subscribe to it as a doctor so I can show it to my patients. Hey, this is, you know, a good source of fiber. Or, hey, if you're going to get melatonin, let's look at this list and see which products actually have melatonin and which ones say it on the label and don't have any melatonin in them.
Or the milligrams are so far off, it's not even,
how much is actually in it? Yeah. Or how much you're paying per milligram.
I didn't know
I've seen it 100-fold different.
Crazy.
So consumerlab.com, if you're super into supplements, I recommend getting a subscription to it so you can check things. They also have a really good email newsletter that comes out weekly. I think it's weekly, with whatever the latest thing is in the world of supplements. It's eye-opening.
There is a lot. Yeah, it is.
Why don't we hit point number 1?
Certain diets you may need to supplement a little bit if you're not getting
and we'll get to that in a little bit.
We talked about.
So this is from the U.S. Preventive Services Task Force, and they said there's no difference in preventing cardiovascular disease or all-cause mortality, meaning anything that kills you, doesn't make a difference. Small reduction in the incidence of cancer. Again, it didn't kill them, but having cancer. But let me tell you how much of a difference. 0.2 to 1.2%. Think about that range. 0.2 to 1.2. Well, wait. What if you go the other direction from 0.2 just as far? You're in the negative. So it's so close to zero that it could easily have been causing as not causing cancer. It's just... no benefit unless you've got a problem coming into it. Okay, let's talk about the RDA.
Yeah, the recommended daily allowances.
And let's go over RDA in the first place. Recommended daily allowance somehow got confused with, what was the other term? Anybody remember? Anyone? Biller? The other term was EAR, estimated average requirement.
Gotcha.
So RDA,
EAR, you don't even really hear about.
The supplement companies just ran with that. RDA, yes, because it's so high that we can sell more.
We can do a percent, yeah. And then
so the EAR is estimated average requirement, meaning this is what if you get that much, 50% of the population will have what they need. That's the mean. Whereas the RDA is going all the way to the worst. It's 97.5% of healthy individuals. Again, healthy individuals, not people with a problem. That we'll get to that. But people who don't have a diagnosed problem, 97.5% of them are covered by the RDA, Recommended Daily Allowance, 50% by the EAR. So you do want to be probably over that 50% to make sure you're covered. I'll give you that.
Sure.
It's funny how it's used by the vitamin and supplement industry.
Yeah.
Not that there's a problem with taking the Recommended Daily Allowance. No, I don't mean to say that.
Yeah, if you're doing that, and it actually is that, not multiple hundreds of percentages above it, then you're fine. You're going to get your daily, you're going to probably make some expensive urine.
So let's look at what our third point is that we want to get across with this. The third point is most people.
Yes.
So we're getting proteins either from meat or non-meat sources. If you're getting from non-meat sources, you're going to be getting from things that have complete proteins, which is a bit of a trick. Mm-hmm. So whole grains, beans, nuts, legumes, tofu.
Well, you're talking about macronutrients.
Yeah, macronutrients. Micronutrients come with it.
Yes.
Fruits and vegetables.
If you're doing those things in their most natural form, you're going to get those.
And we're going to go over a few exceptions.
Micronutrients. Yeah.
At this, I think this is where we're going to go with the exceptions. Let me see. There are some exceptions.
Certain
and
things.
So we're going to tell you who those people are. So again, plant-based. So you notice I say plant-based a lot and non-meat proteins. So if a person is a strict vegetarian, I recommend that they supplement with vitamin B12.
Yep. That's a good idea. But
so there's an exception there.
100% of B12, not multiple thousand percent.
Please not. Please not.
Look at the label, please.
Point 4, Dr. Gwain's going to tell you about that. Okay, and then notably, supplement users, both adults and children, so the people who are going to GNC, already consume higher quality diets than non-supplement users, suggesting those taking the supplements often need them the least.
That is ironic, isn't it? Yeah.
Oh, my goodness. Okay.
I wanted to actually, before you go on, mention a few more things. If you're pregnant, you should be taking a supplement for your growing.
So we'll get to point 4.
Yes, we will. But we're talking about special populations here. Pregnancy, you should be taking a pregnant. Is that part of it?
That's point 4.
Okay.
Actually, that's point 5. I'm sorry, special populations.
Oh, okay. Special populations. I guess we're jumping over.
Let me do point 4 before we get to point 5.
Let's do that.
Okay, point 4 is some supplements can cause harm, particularly when taken unnecessary. What's your example?
I can give you vitamin examples. His B12 was off the charts. We met shortly after that and kind of I said, hey, your B12 is crazy.
That's crazy.
Those are the medical diagnosis words there. And he was actually taking a supplement recommended by his podiatrist for neuropathy, which had multiple thousand percentage of B12. So he stopped it. Symptoms went away. His taste came back to normal. So that's one example there. So B12 can help with neuropathy, but not in excess. It can actually, again, cause harm. Another one just recently was a gentleman who was having paresthesias or weird nerve feelings in his fingers. And one of the things is just check vitamin levels on that. Checked his B6, and his B6 was off the chart, and he looked at a few things, and he was taking excess B6. It was, I think 400% or something of the normal. So these are things that you should be aware of. Excess vitamins, hypervitaminosis, as it's called, can be dangerous and cause issues. Sometimes irreversible damage.
So as far as specific ones, beta carotene or vitamin A increases lung cancer risk. And cardiovascular mortality.
Yeah, that we're aware of that.
Vitamin E, also hemorrhagic stroke with vitamin E, kidney stones with vitamin C and calcium. So these are things you don't want to take extra of unless there's some kind of reason.
A medical reason.
Yes. So, and we'll get to more of that on number 5 here. Even multivitamins, just a multivitamin, not a specific vitamin in excessive amounts, just a regular multivitamin can cause rashes and nosebleeds.
And we're not even talking about, and this is in healthy people, this can happen. We're not even talking about people who are taking other medications that may interact with some of these things when they're taking it in excess, especially some of those.
Like vitamin E with anticoagulants.
Exactly. Vitamin K.
Or worse, vitamin K. Right.
So there are things to be aware of. There are true interactions you
can actually get liver toxicity from vitamin K.
Right.
Sorry, Dr. Doisy.
Dr. Doisy.
He discovered vitamin K.
Oh, gotcha. Okay.
Yeah.
And then we're just talking about vitamins. We're not even getting into herbs, which have true interactions with a lot of medications. They can either upregulate some, downregulate others, because they can work on liver, some of them.
Imagine that. If it's being taken because it might have some benefit, it's possible it has some
negative effect as well, or interaction with something. If it's doing something, it's doing something maybe bad as well.
Yeah, there's this misconception that
it's all good. It's all good.
Medicines that come from the pharmacies have this long list of side effects.
That's right. Because they test for that. But if it comes from GNC or the health food store...
Oh, there's no long list of side effects. It can't harm me.
It's not listed on there because it's not used to treat, diagnose, or whatever.
Think along the lines of...
You do need to be aware of that.
If it can impact my body for good, there's a chance it can impact it for bad. If something's really impactful one way, it may be really impactful the other way. Or
sure.
If it doesn't have any effect on you, negative, maybe it doesn't have any effect positive either. Which I guess we should go over. What's the harm? What's the harm?
Oh, yeah.
If it doesn't harm, if taking the vitamins or supplements, if we're not taking them in excess, we're not doing it in a way we're expecting harm, what's the harm in taking it for whatever we imagine benefit we're getting?
It may be unknown. I mean, it may actually be significant. Like I said, if there's an interaction with a medication or some organ toxicity that we don't know. If it's good to discuss all of those. Like I'm constantly telling people, let's get off most of those supplements.
Yeah. So I'll agree with people who would say it's not harmful to take if it's not harming you. I agree, but I just really have a problem with dollars being spent for something that's supposed to be for health or wellness going to this industry that is making false promises.
Oh, yeah.
And rewarding really, really bad behavior, because the people selling this stuff are one of two things. Either they're criminally negligent in not being educated that it's not helping people, or the other one is deceptive.
Sure.
And a charlatan and deceiving people. It's one of the two.
Right.
And both of those are really, really bad things.
Have you ever walked into like a health food store and just listened to what
I can't stand it.
What some of the people say? Yeah, they're making claims.
Practicing medicine.
They are literally practicing medicine, saying, "Oh, this is going to help this disease that you're having. Take this supplement or whatever."
Yeah. And
practicing medicine without a license yet.
And
somehow,
not to say they don't have articles that they point to, but they're not the ones in the journals we're looking at.
Right.
And they're not done with the rigor and confounding variables up the wazoo.
And taking into account everything about that person. If you walk into a health food store and you're like, I've got a migraine, what supplement's going to help me? Well, they don't know what. Are they going to ask all of your medications that you're taking? Are they asking about other, things like your high blood pressure that's going to go awry when they give you a stimulant? Those are things that, as physicians, we take all that into account before we prescribe a medication. We're not just throwing things out willy nilly.
Which is why we're not quick to just. When somebody calls up and says, "Oh, can you send me a prescription for such and such," and we have evaluated what it's for. Mm-hmm. We have a higher standard that we are held to.
Yep.
And that's why we don't just willy-nilly do things without thinking or looking in the chart, because we are aware of the the great weight that sits on our shoulders for responsibility for people's health, because we're held accountable. Next, number 5.
All right, I was going to say pregnant women, they say a multivitamin. I think they're just making sure you're filling any gaps there because you do have a developing fetus inside you. But the big one for that, big one is folate. Folate is a necessary that you do need to get slightly higher levels of for neural tube development in a fetus.
And oftentimes we're supplementing iron in women of menstruating age, even though they're not menstruating when they're pregnant, because it's hard to keep up on the manufacturing of the hemoglobin when you're losing blood through menses every month, and you want to have that anyway. So that's why the iron is included oftentimes with the prenatal vitamins. You said folic acid, vitamin D and calcium for bone health. That's true not only for older people or specifically older women, but also older men oftentimes, and for kids. There's a lot of kids that aren't getting enough vitamin D, especially depending on what part of the world you're in, if you're not getting a lot of sun exposure. I should have known this, but I did. Children with darker skin actually need more vitamin D supplementation because of the pigment. It's actually causing less vitamin D manufacturing in the skin. Did not know that.
I actually did not know that either, but that's
I thought it'd be the other way around. Okay, and then vitamin D for risk of rickets. Also, children who are nursing oftentimes aren't getting enough vitamin D, so that's why often you see vitamin D as a supplement that's in milk. Vitamin D milk is a very common supplement.
Iodine.
And iodine in salt.
Which is now in your salt.
Yeah.
Before that, there's this huge... And people don't understand. There's this huge thing to go to natural salt, sea salt, whatever, Dead Sea salt, whatever it is. That's not iodine. Oh, no. Iodated. Iodinated. That's the word I'm looking for. Iodine. So before we had iodinated salt, people would just walk around with these big old goiters. Their thyroid, you'll see it. Their thyroid would be working overtime trying to manufacture, try to catch all the iodine in your system. Once we started putting iodine in salt, that essentially went away. So you do need to get a little iodine in your system, or and just doing salt that doesn't have iodine in it, you're not getting it there. And there's not really many other areas.
More of a problem in the upper Midwest, I believe, than other parts of the country. Don't know why they don't have any iodine in their soil.
I was just going to say other people like salt more, salty foods.
Okay, I think...
I want to mention one more thing. Certain medications you do want to supplement with supplements as well, because they can deplete them. The one that comes to mind is methotrexate and folate. You probably know that one.
Or the PPIs, omeprazole, pantoprazole, esomeprazole.
Yep. If they're those are for acid. Reflux.
Yeah, because they're decreasing the acid in the stomach, they decrease absorption. So you're going to have some supplementation there.
Yeah. Mm-hmm. So those are things you should talk to your doctor about if you are on certain medications. Typically, they will bring that up and mention that for those higher risk medications. And
I believe we've covered most of the major situations where a person would need some kind of supplementation with supplemental either macro or nutrients. Micronutrients refers to the vitamins and minerals. Macronutrients refers to the fats, protein, and carbohydrates. Right. So that's macro and micro when it comes to nutrition. If you want to be a part of this and have your name at the end of this video, I also put your name at the end of the Dr. Vaughn videos too. If you'll notice, you'll see at the end of those videos it has the same names. The people who are on Patreon, it's patreon.com/Dr. Vaughn. Easy to remember. Thank you to people like Lindsay Antwine. Thank you for what you do to be a part of our show. Until next time,
I'm Dr. Green Vaughn.
Dr. Mark Vaughn telling you to stay in good health.